So I want to welcome everyone to the Silks Legislative Subcommittee meeting for July of 2023. We will begin with verification of posting and introductions. Wendy, when was the agenda posted?
Yes, it was.
And then we have special guests today, so we will be addressing those in just a moment. In the meantime, is there any public comment? Hearing and seeing none, we will skip the minutes for now and move on to Nellis access. Does anybody have any quick questions on how to access Nellis? And we will be making, Dr. Cosgrove, would you be so kind as to Dropbox that, the Nellis 101 video?
Sure, absolutely.
Thank you. So we will be making a Nellis 101 video available after the meeting.
Are you clicking on the agenda? Did you open the agenda and click on that link?
Wendy, we can hear you.
Okay.
Stephen, I can't, I'm sorry, this is Dawn Lyons. I just noticed you asked Dr. Cosgrove to Dropbox something. Is that something you want us to share? Because we can't share something in a Dropbox.
Did you mean to put it in the chat?
Well, no, so that it can be accessed by folks after the meeting.
Oh, okay. I know what you're saying.
Got it.
Yeah. So Wendy and Dawn, it doesn't need to go into the Dropbox. I just need to make sure that it's formatted correctly. That's what he's asking for.
Okay, thanks for the clarification.
No problem. So I believe we now have 2 members. Is that correct?
Wendy, can you, or Dee Dee, is Linda there at the same computer as you, or are you joining separately?
We're joining separately.
Ah, I see. She's in the waiting room now. I'm letting her in. So as soon as Linda's in, we will have quorum.
Got it. So we will briefly go back to agenda item number 3, approval of the minutes. Are there any corrections that need to be made? Hearing and seeing none, can I accept a motion to approve the minutes as written?
I make
Dee Dee, say so moved.
so moved. I'm sorry, a little spacey this morning.
That's okay. Do I have a second?
Hey, Linda, are you able to speak? Are you able to second the motion?
I'm good. I'm sorry. I'm at a friend's house because my internet is down right now. So I had to go down the hallway. So I'm here. And what are we doing? Because I come in on the tail end of it, I guess.
Okay.
So
We're
there's,
approving the minutes.
yeah, there's a motion to approve the minutes. Do you, would
I
you,
approve. I second the, or I think I second the motion. Yes.
Got it. We have a first from Dee Dee and a second from Linda. Is there any final discussion? All those in favor, please say aye.
may I interrupt? This is Dawn Lyons. I just wanted to remind everybody that although we need 2 Silk members for quorum, they are not the only people here that are allowed to speak. Anyone here who is present is considered part of the subcommittee for today and can speak and participate, just so you know.
Gotcha. Thank you for that, Dawn. All those in, so we had a aye from Dee Dee, Linda. Do you approve?
I might, if I were you, Stephen, just ask if there are any in opposition or, and then if no one speaks, I would take it as it's approved.
Are there any opposed? Are there any abstentions? By unanimous vote, the minutes are approved. Moving out of order, we are going to go to agenda item number 7, updates from the DHHS Director's Office for the 2023-25 biennium for budget changes. And we're going to welcome to the table Marla McDade Williams, Deputy Director of Programs.
Hi, good afternoon. I don't know if you have my presentation or if you want me to share it, if I have the ability to share.
You do
don't-
have, you are able to share if you'd like to. I didn't receive it, so if you could send that to Wendy or myself, we can put our emails in the chat.
I'm sorry, so email it now and then share later, or,
You
Get it
can,
now and email later,
yes.
even for the record.
okay. Well, I'm trying to figure out where the share option is.
Should be next to the participant.
Oh, there it is.
At the bottom.
Okay. All right, can you see it?
Yes, we can.
Is it in slideshow mode for you or no?
Not yet. I think from the beginning is where it goes into slideshow mode on the very left-hand side.
From beginning, there we go. Okay, thank you all for the invitation to do this budget overview today. As you know, the Director's Office oversees 5 of the major divisions within the Department of Health and Human Services, which is Aging and Disability Services, Child and Family Services, Public and Behavioral Health, Welfare and Supportive Services, and Healthcare Financing and Policy. We administer in the Director's Office a couple of major grant programs. The Fund for Resilient Nevada, which is the opioid settlement dollars. So it has been divided up by goals. And you can see here the proposed funding estimates for fiscal year 24 of 1.6 million for goal 1, 1.6 million for fiscal year 25. And that relates to ensuring local programs have capacity to implement recommendations effectively and sustainably. Goal 2 relates to preventing the misuse of opioids. Proposed funding level of about $2 million. Goal 3, harm reduction, proposed funding level 1.4 million. And then goal 4, behavioral health treatment with approximately 2.7 million in fiscal year 24 and 1.5 million anticipated in fiscal year 25. Goal 5 related to recovery communities. We have not determined proposed funding estimates for that yet. Goal 6 relating to opioid prevention and treatment. And again, no funding levels proposed for that. And then goal 7, which is high quality and robust data, about 743,000 for fiscal year 24 and 520,000 for fiscal year 25. We also have the grants management unit, which administers the Title 20 Social Services Block Grant, Community Services Block Grant, and the Fund for Healthy Nevada. Under the Social Services Block Grant, there are a variety of social service areas or funding goals that you can see. And annually, we receive about $14.8 million under the Social Services Block Grant. Under the Community Services Block Grant, there are approximately $3.7 million available. And this is for states and the community action agencies to work together to achieve goals for low-income individuals. And then finally, under this grant, we have the Fund for Healthy Nevada. We administer funds directly, and then we also have funds are sent directly from the controller to sister agencies for them to administer. So here is a chart. This is a legislatively approved chart identifying the various programs that receive funding. This also includes some changes based on increases or decreases of funding. We have the Office of Data Analytics within the Department of Health and Human Services Director's Office. And that is, it really is focusing on coordinating cross-divisional analytics to drive policy and decision-making throughout the department. So that's a short overview, again, of just the programs administered here out of the director's office. We also have Part C, which oversees children's IDEA Part C, and we have the Office of Minority Health and Equity, and the Office of Disability, the Governor's Office of Disability. I can't remember the last part of that. But those are the major programs, and I'm available for questions. I didn't want to take up too much time given your long agenda today.
Thank you. Are there any questions from Marla? Hearing and seeing none, are you comfortable if folks think of questions afterwards if we send those off? And if so, how would you like them to be routed?
I mean, you can just email them. I'll email this out to, if somebody will just message me who I'm supposed to email it to, or put it in the chat, then I can send that email and then you can respond to me directly.
Sounds good.
This is Dawn Lyons. I did put my email and Wendy's in the
Okay.
chat, so.
Great, I see them. Thank you.
Concluding agenda item number 7, we're going to go back to agenda items 5 and 6 and invite Drazanella's Administrator of the Rehab Division and Michelle Merrill, Deputy Administrator of Programs, to the table.
Well, good afternoon, everybody. My name is Drazanella's. As Stephen said, I'm the Administrator of the Rehabilitation Division. So very excited to announce that we feel that we've had a very successful legislative session. Unlike our counterparts at DHHS, we do not have a presentation to share, but I'll kind of go through some of the gains that we've gotten during this legislative session. So one of the things that we've asked for is, also let me start that we say we did not have any bills that we have asked this session to be amended or introduced. We did have 3 requests during the session, and one of them was to add 2 additional internal job developers to our team, essentially 2 positions to expand our internal job development team. We feel these are, and these are also something that we've that has been approved by the legislature. So we've gotten those 2. What these positions will do is actually help us expand our internal services for job developers. That will also help ensure that we continue to maintain certain level of customer service from this particular team. We have lost a lot of the contracted job developers during the pandemic, as a lot of these entities were smaller kind of mom and pop type businesses, and a lot of them have kind of closed shop during the pandemic. So it was definitely needed for us to be able to keep serving the clients without any delays. Also, it was also important as we, after the pandemic, have seen a significant increase in number of applications for VR services. The second thing that we asked for was adding 3 transition coordinators to our team. This is, as some of you may know, after the passage of VOA in 2014, the state VR agencies have had a mandate to improve or to add transition services for youth 16 and over. And in Nevada, we actually have expanded that to 14 and over. Up since kind of the start of that VO program, we've only had 1 position, which was a program officer 3, that kind of helped coordinate all these efforts, and in kind of working with all of the different educational entities out there, so different school districts, schools themselves. It was difficult to maintain contractors and to ensure that we have certain tenure with the contractors. We've seen a lot of kind of attrition in that particular field, so we've wanted to kind of have some state employees so that way we can kind of ensure that consistency. So these 3 transition coordinators are going to be located, one in Reno area or Northern Nevada, one in rural areas in Elko, and one in serving Southern Nevada. And we feel that they will be definitely very beneficial to our agency and also to all Nevadans with disabilities, with especially the youth with disabilities or students with disabilities themselves. As we feel that we'll have a lot more consistency and a lot more tenure with these staff, and this will be kind of beneficial for us to keep growing our transition program as we have been doing over the last couple of years. And the third thing that we've asked for is addition of Disability Benefits 101 portal. And as some of you guys may know, this is one of the huge areas that Nevada needs to improve in, is ensuring that we have disability benefits planning in the state. Currently, there is no government funded position or contractor that resides in Nevada that can help folks with their disability benefits planning. So as folks are looking for jobs and they're receiving Social Security benefits, either SSI or SSDI, they're, all these folks who are receiving those are wondering how will their benefits be impacted if they start work, how much they can work before their either medical or financial benefits are impacted, how much they will be impacted. This particular portal will help with that. Folks are going to be able to create their own unique accounts and find out personally kind of how they will be how their benefits will be impacted. There is no staff support for this particular portal, and that is something that we're going to continue working on in the future, but it's definitely a huge step in the right direction for us to receive these. Besides our staff and VR clients, any other entity that's out there that could benefit from this portal will be able to have the same access as us. So the whole state of Nevada, the government agencies, nonprofits, or individuals themselves will be able to sign in, create their own accounts, and do the research as to how their benefits will be impacted. While the funding for this has been secure as of this year, the development of the portal itself will take at least a year, with the addition of us having to contract with this particular entity as well, and kind of go through that lengthy state contracting process, getting the contract in place, then doing all the research as to what all benefits exist in Nevada. The portal will be very Nevada specific, so they're going to do all the research to see what all benefits exist here and add all of that information to this portal. So we are hoping that the portal will be live and active as of probably fall of next year. Hopefully that will happen before that, but that seems to be a much more realistic kind of goal for us. Once the portal, or before it gets up and going, we'll make sure that we work with that particular vendor to create any kind of training materials that we can share out with all the interested parties that they can have access to. Our staff will not necessarily be experts in this, so we're going to be learning kind of along with everybody else. And as we can kind of get support from the vendor, we'll make sure that we share that out. But they want to kind of share that. I think this is a huge win for Nevada. It will be 100% funded by the VR program, and as I mentioned, everybody's going to have ability to access it. So those are the kind of 3 legislative gains that we have. And Michelle, I'll kind of turn it over to Michelle if she has anything to add to what I talked about.
Nothing specific. I think Drazen covered all of our big wins, but I think we're really excited, especially about the DB 101. I think that's going to be a big improvement for all of us in Nevada who are trying to help people understand their benefits. I think that's gonna do a lot for people because it's not meant for one program. It's not meant for one population. It's meant for everybody. And it's going to be very user-friendly. We'll certainly be working with our partners to make sure that we include everything that needs to be there and that it's a tool that isn't just another thing out there, that it's a really used thing. So we're very excited about that. And I'm very excited about the job developers. I think that they're going to help more people get jobs, and that's really what we're about. So I think that the session went very well for us. I think that overall we're very happy with it. I'm thrilled about the raises for state employees. I think that's going to help with retention. That's been a huge problem for us in rehab. The lack of raises, even cost of living, was really making it impossible because we couldn't compete with the county, different county programs like social service programs paid more than the state did. So we would lose good staff perpetually. It felt like we were a training ground. So I think that the raises are not only a personal happiness, but I think they're going to be a profound impact for our program. So I'm really happy about that. So we will take questions.
Are there any questions for Drazen or Michelle? Cindy?
Hi, thank you for taking questions. When we discussed Northern Nevada, rural Nevada, and then Southern Nevada. So I actually live in Boulder City, and I did not realize when we moved here that this is considered rural. So this area, which is just a little past Henderson, where do our folks in this part of the state get our support from, rural or Southern Nevada? That's one question. Then I've got another one, but if you can answer that.
Sure. Our largest office, speaking for Voc Rehab and no other program, Voc Rehab's largest office is actually in Southern Nevada. That's what we call our West Bay office on Charleston. And we have a Henderson office. So I imagine because Henderson is the closest to Boulder City, you would be served from our Henderson office.
So we are considered Southern, not rural.
Right. When we say rural, we mean like Ely, Elko, Winnemucca, Fallon, Wendover, that whole kind of central and northern eastern edge of the state.
Okay, thank you. And I appreciate the benefits 101. That's there's a real struggle around here for that sort of thing. So that's a really important thing that we're getting. But I'm wondering, it is so complicated. It is, as you all know, it's very complex, and we make mistakes. Social Security makes mistakes. They claw back money. We don't know what the heck they're clawing back money for. Will we ever have a real human being doing that sort of work in this state?
Yeah, so let me, so I would say that as we have looked at the issue with the lack of benefits planning in the state of Nevada, this was essentially the first step in that direction, and probably the easiest one that we can implement. It's a pretty expensive project itself. Us to get this project off the ground will cost about $600,000, and for a small agency like we are, this is definitely a significant kind of level of fund that we are taking away from other aspects of VR and setting aside for development of this particular project. What we are hoping is that in the next session, as we go forward, that we will look at asking the legislature for specific position or positions to have in person, to have a staff member within the VR program that would be able to provide these benefits. Obviously, that is something that's out of our control that we can decide solely, but we are as we plan for the future, that is part of our plan, is to hopefully the next legislative session ask for at least one individual that we will be able to hire to be experts in this, and we'll definitely share that out with everybody, and would appreciate everybody's support as we go to legislature and the governor asking for these particular gains. So
thank you.
Yeah, and Michelle, I don't know if you want to add anything.
And thank you. And to your point about things being difficult, benefits planning is very difficult. We have been told by other states who use the DB 101 website that it's actually quite easy. We are good friends with Arizona, and they have had it for a few years now. And they say that it's been a real help to the program and the participants, that you really just have to answer a few questions like, how much are you receiving? What are you receiving? And if you have your stub, you would know the answers to the questions. And you can put in, it has calculators to say, well, what if I worked 30 hours a week? What would it do to my benefits? What if I worked 15 hours a week? So theoretically, we're told it's pretty easy. We are hoping so, but we also hope that it gives us the leverage perhaps to go to legislature, as we said, and ask for a person.
Thank you, Cindy. And I just want to make one point of clarification. If folks can state their names when speaking, we would greatly appreciate it for the minutes. And then I have two last questions. Cindy stole one of mine. The first one is in regards to the internal job developers. What is 700-hour and state as a model employer going to look like as a result of those additions?
You want me to take it? You got it.
I'll start and then you can kind of wrap it up. So I would say that the internal job developers are independent of the 700-hour program. 700-hour program kind of sits at a different spot. We did not get a support person for this program as it was initially rolled out and expanded a few years ago. The VR program has not been granted a position to manage it. So while us having additional staff will definitely assist with us kind of being able to share some of the workload of possibly of managing that particular program. We can't kind of hope for much more significant changes than that. And then Michelle, if you.
Right. We took a swing, and not all swings connect. So we didn't get another body to run the 700-hour program, but Tammy Riley is still capably running that program. And I think that she will be able to focus perhaps more on it now that she has other team members that can do other things on her team. By the way, Michelle Merrill, for the record. And I think the other thing that is good to share is that we have done a summary of the last 12 months of the calendar year. And we are very happy to share that the state of Nevada itself is the #1 employer, full-time employer of people with disabilities in the state of Nevada, in terms of the people that have been hired through Voc Rehab. So we think that's great news. The state is demonstrating itself coming into a model employer, and we're really thrilled that the program's growing. We've done a lot of marketing to the 700-hour program, so hopefully it's paying off. We know that there was some legislative changes perhaps to some of the things that will affect how DHRM is helping state agencies to understand the program and disability in general. So we will certainly be a part of that. And we will do our best to make sure that state agencies have disability sensitivity and awareness and all of their questions asked so that they can do more hiring, because it's really good. So.
And this is Josh Nellis for the record. So the only thing of that is that in us attempting to educate the state managers on how to use 700-hour program and how VR can help support them. We've also worked on creating different training materials, training videos for the state managers as well, just to hopefully simplify and demystify the process and hopefully reduce any kind of anxiety that some of these managers may have about working with the VR program or any of our clients. So.
And then my second question relates to the transition additions. How will that affect the 15% roll off? I'm not sure that's the right word, but the 15% top line spend that's required under WIOA.
So what I would kind of just like to clarify on that. So while the federal government states this as being 15% of the overall VR grant, it is 15% that is required to be spent only on direct services. So it does not include any kind of logistical or administrative support that this program may need. So realistically, what it actually means for VR is that not 15, but 50% of our funding of direct client services are now required to be spent on transition youth, on non-job related services. So this is just kind of education about the potential of the individual as they kind of seek what type of employment or career they would want to enter into. So it's definitely a significant impact on what we're able to do. And as 75% of our clients are non-transition clients, now we have 50% of that money to spend on them and 50% on the transition transition potentially eligible clients, not even direct clients yet. So how to answer your question specifically, it would definitely be very beneficial for the agency. Will help us be a lot closer and hopefully reach that 15% required that we are asked. It is not new 15%. We have had contracted transition coordinators these last few years, and the way that essentially we presented this to legislature and the way that it's true in actuality, we've been able to use these contracted positions as a way to test out whether these positions would work if they are part of the state agency. So we are essentially just converting the contracted positions into permanent state positions. Of course, these contracted positions would apply, and these jobs would be open competitive as any of the other state employee jobs would be. So we would lose those 3 contracted transition coordinators as we are now getting 3 permanent state employees. So it will increase some of the spending that we've had in pre-eds, but those positions directly won't be a huge change. The change that they will help with is ensuring that the programs that we have in place, such as putting PACE labs in different schools, or having a virtual job shadow program, or having our summer youth internship program, or having the summer camps that we put together for students with disabilities, we will hopefully see much better outcomes, much better consistency in the customer service that we are able to provide, and improvement in the relationships that we have with the various school districts and school themselves, as hopefully we reduce the attrition in these positions and the turnover. So.
And if I may add, this is Michelle Merrill. Although the net number of people will remain the same that we have on staff, because they're going to go from 30 hours as contractors to 40 hours a week as state employees, those 3 people represent another, really the equivalent to what another contractor would have been able to work. So it is almost like we gained another person in terms of time. So, and I think that we won't have quite the revolving door of staff leaving and coming with contractors that we would hopefully with state employees.
Yeah, thank you. And then just a quick follow-up on that. What is the cutoff between transition and adult? Is it 22 or 24? I can't remember.
Transition services go to, it's different. Students are up to their 22nd birthday, and then you can be a youth older, but for our purposes, pre-eds ends at their 22nd birthday.
Got it. Thank you. Are there any final questions for Drazen or Michelle? And then I'm going to read Michelle's chat message into the record real quick. So she's listed what the pre-employment transition services activities are. They're counseling on post-secondary ed, instruction on self-advocacy, job exploration, work-based learning, and workplace readiness. So those are the 5 components of pre-eds. With that, any final questions for Drazen or Michelle?
And this is Drazen Ellis for the record. So I also put my email in the chat if anybody has follow-up questions after the meeting, or definitely feel free to reach out to myself or Michelle. I'd be happy to provide any answers that we have. And if you don't have them, we'll try to find the answers.
Appreciate it. moving on to agenda items number 8 and 9, which is going to be ADSD budget update. Jeff, the floor is yours.
Good afternoon, everybody. Jeff Duncan, for the record, agency manager with Age and Disability Services Division. I did submit the one pager. I didn't do anything too fancy, but does somebody want to pull that up, or do I need to try to share my screen? And if Wendy was on, or if somebody could help me pull that up.
Wendy, do you have that handy? Otherwise I can email it to my other computer so I can open it.
This is Wendy Thornley for the record. Let me grab that. Hold on one moment.
Yep.
Don, I'm not sure I have sharing capabilities on my screen.
Well, this is Jeff Duncan. I always have troubles on Zoom and my computer is really lagging. So I'd rather keep my camera on and somebody else try to.
Okay,
I've knocked Teams out and everything like that, but my computer's lagging severely right now.
oh, I
So,
see it. Okay, let me pull it up on and I can share it.
Thank
One moment.
If you have trouble, I just did email it to myself. So in a minute, I'll be able to pull it up if you can't.
Okay, let me know if you guys can see this. Jeff, you can let me know when you want me to scroll down.
absolutely. So it's Jeff Duncan again. Thank you, Wendy, for pulling that up. I won't read what's on the summary here for you all, but I will go budget account by budget account. But the first thing I want to make sure I mention that you'll see references in this that we pulled our decision units out of our budget. And there's two different types when you're looking at a budget. A M unit, which is called a maintenance unit. That is our caseload mandates, and those things hopefully go according to plan. They get funded because of the methodology behind caseload growth and whatnot. But then you're also going to see other decision units here called E units, and those are what we call enhancements. And those do require budget approval and new money to fund such things. So I will go budget account by budget account because some of them are a little bit more complex, and I'll stop after each one to take questions if that's okay with you, Stephen. That would be easier to break it down by budget account by budget account. So the first one here, I just want to go over our new budget accounts. And this one is pretty straightforward, but we did create some new budget accounts all about increased transparency for each one of these specific areas. Many of these were housed under what I call the mega budget account. And so now they have their individual budget account. So one is the council for you all, the statewide independent living council. So that's now 3283. Then we have our adult protective services and our long-term care ombudsman program are in their own standalone budget account. The next one there is the facility outreach and community integration services and money follows the person. And I'm going to cover that at the end, but that is two new programs and now under the new budget account here at ADSD that were formerly at Medicaid. And then the last one there is 3278, which is all of our grant funding, our pass-through funding, our state general funds, our tobacco settlement dollars, et cetera. So that's now in its own standalone budget account for transparency and quite frankly, for tracking purposes. It was kind of a nightmare with everything housed under one budget account. So I'll pause there to see if you have any questions about those new budget accounts before I go on to our administrative account.
Are there any questions on the new budget accounts?
Okay, so hearing none, this is Jeff Duncan again. So now I'll go on to our 3151 right there, Wendy, if you want to scroll down just a little bit. Perfect, thank you. So this one here is what we call our administration and federal programs. What you can think of this though really is our the nuts and bolts behind the scenes that make our agency go. No agency can run the wonderful programs and all the services we have without our information technology, our human resources, and then obviously our fiscal department. So in this highlight here, I just want to mention that for some of you who've been around, I've only been here for 10 short years. Our agency has continued to grow. And unfortunately, these 3 areas did not grow with the caseload growth, new programs, new funding with ADSD. So really, this session, we were able to finally get some wins, as our previous state agency was mentioning, about finally getting some wins in the budget to support our just general growth. And there's a lot of data behind the scenes, but I just wanted to bring that up, that this finally we've had some support to add additional information technology, human resources, and even a fiscal team member to help us with our overall operations of our agency. And again, this is in the administrative count, so they provide support for our entire agency with our multiple budget accounts. So with that, I'll be happy to answer any questions you may have on 3151.
Are there any questions on the admin account? Hearing and seeing none, senior and disability RX.
Thank you, sir. So it's Jeff Duncan again. So then for our senior disability RX program, I'm just going to speak to the budget, but I'm going to mention a Senate bill, but I know I'm here to talk about our budget, which is different than the Senate bill. But in this enhancement unit here, we requested to combine 2 of our categories underneath the senior disability prescription assistance program. Before, we had a senior disability or senior RX category, and then disability. And unfortunately, we weren't able to move money in between those categories. And so this now gave us the ability to combine the categories into one direct service line item, and then gives the program the flexibility to shift funds based on need. Now, we'll go deep into this program because there's been a lot of changes, but with Senate Bill 4, the beauty with that getting passed this session is that now during the session, or then this legislative session, they approved us to remove the criteria that it has to be directly administered by the department within DHHS or ADSD. And we are now in the process of just starting to have conversations about what that might look like, because currently it is a Medicare only program. So only those who have a Medicare Part D plan qualify for this funding. With the Senate Bill 4 and the flexibility with the combination of these categories, now we'll be able to engage. We're going to talk with Silk. We're going to talk with our Commission on Aging, CSPD, and see kind of where we might potentially drive this funding, still around prescription assistance, but for a much broader population. So luckily, this now gives us that flexibility where we can triage efforts on that. And I know I'm only talking about our budget, but Senate Bill 4 definitely impacted that. But any questions on 3156?
This is Stephen. For the record, I do have one quick one. I noticed in the director's office presentation that there was a $500,000 reduction. Did I read that correct in that budget account? Did I read that correctly?
So it's Jeff Duncan for the record. Yep, that is correct. And that's because of our reduction of the utilization of this program. So therefore, what we spent in our base budget is kind of what we got in this last legislative session. So we hope with the new program, if we're successful and we really can create a program that will work, we can show the need, demonstrate the need. Unfortunately, if that means a wait list, we can at least demonstrate that we need additional funding to support this type of service. So that's why the reduction, because of the overall caseload projections. Right now, there's about less than 400 people on the program. And a few years ago, it used to be, quadruple that number. But with all the changes in the Medicare landscape, the closing of the donut hole, again, I don't want to go deep into this, but with the plans being competitive, having a 0 premium on their plans, many individuals didn't even need this program any longer. So that's why we've seen such a reduction in the caseload. Wendy, we're now seeing Dawn. Thank you. This is Jeff Duncan again. Any other questions on 3156?
Hearing and seeing none. Developmental Services, my favorite account.
Right on. So this is Jeff Duncan again. So I am not the agency manager over developmental services. But if there are specific questions, I'll be happy to take them back and report back to your subcommittee. But for developmental services, I want to point out the three enhancement units here. One considering that around the rate increases from a study that was done by Burns and Associates. And then the second one there is the modification to the monthly allotment from 450 to 650. And then the third one there about the contractual board certified behavioral analyst to support individuals with the high behavioral and complex needs. This one here was done at our Desert Regional Centers, but now this one is opened up to our RRC and SRC. So in that, I wanted to read some of the notes that was provided to me so I can give you information about each one of these E-units. So specifically for E250, the anticipated that the rate increases will hopefully reduce our service wait lists and also our wait times, because again, our providers are able to continually grow with the individual served. Hopefully the new rates will help address some of that workforce shortage like everybody's been seeing across the state as well. And then on the, oh, that's the only note I had specifically on that one, excuse me. So is there any questions on E250, E252, and E255? And I'll probably won't be able to answer myself, but I can definitely go back and get the information for you.
This is Stephen for the record, just on 250 real quick, which rates were affected?
Good.
The rate study.
This Jeff Nerd for the record, I'll get that and follow up with you.
Thank you. Any further questions on developmental services? Hearing and seeing none, 3166.
Okay. So this is again under developmental services. And this one here was the increase in the monthly allotment from 374 to 486. So the preservation program is available only to families who are caring for a family member with severe or profound intellectual disabilities. And that's pursuant, and living in the home, that was pursuant to NRS 435-365. And due to the program guidelines, a relatively small number of individuals were served by the regional centers who would qualify for the program. But they're hopefully with this recommendation that the allotment increase will have a benefit on the families who do qualify for the program. And we haven't seen an increase in this area since fiscal year 2009. And that's the last part I have on that, and happy to take any questions you might have.
Any questions on family preservation? Hearing and seeing none, 3266 HCBS.
And this is Jeff Duncan. So I want to highlight here that this is, you'll see under this category is the M units. This is again the maintenance caseload. So we, as a part of the budget request, working with the Office of Data Analytics that you heard earlier from the director's office, this all gets put into these formulas and these scenarios, and then we are able to see what the projection, population growth, the need, and then we get slots for certain one of our programs. The first one there, you can see is around our personal assistance services, then our COPE program, and then also our waivers that are administered by Medicaid. But all that goes into the formula, and then we get slots. What I want to mention here is, I think everybody has heard this over the last few years. We, like everybody else, are facing a severe vacancy rate with our individuals who perform our intake functions to the case managers who do the direct service. So while we might have received caseload growth, we are not even able to fill the current vacancies for somebody who can get onto a waiver, or maybe even our state programs, the COPE and PAS programs. So while we might have received these, we probably won't be able to fill them until we address our current vacancy rates. In fact, in the closing document, some of these positions that did get released, we have to provide justification that we're actually able to fulfill them, sustain them over the next 2 fiscal years. So just to speak for my programs quickly, that our intake for the waivers was down about a 50% vacancy rate when we went through the session. And then our ongoing case management doing the direct service was facing about a 30%. None of that has changed dramatically since the session. We too are hopeful that the rate of pay increases will make it very attractive for us to get maybe new people and retain our team members currently, but some is yet to be seen on that. And then the other ones were some of the reductions in the wait list for COPE and PAS. And then the last one there was the caseloads for adult protective services and the long-term care ombudsman program, who I might add are also facing vacancy rates in their current programs. APS was about 50% during the session, and the long-term care ombudsman was around 25%. So I don't want to be the downer on that information, but the vacancy rates that we face do direct our ability to get people onto the programs and give them quality services. But we're really hopeful that some things will come to be with the new increases in state pay. So before I go on enhancements, I will pause there to see if you have any questions on the caseload.
This is Stephen for the record, just real quick. Is the ID waiver covered by developmental services, or is it supposed to be in HCBS?
So it's Jeff Duncan for the record. So that is under developmental services.
Got it. Thank you.
Okay, not hear any other questions. This is Jeff Duncan again. So now I'll continue for our home and community-based services budget account, 3266. Now, many of these that you're seeing here are being shifted around. They may not stay under the same budget account, but when they went through the session, they were under this. So the first one there is some American Rescue Plan funding that we had through the federal government. We got very blessed that we got to continue 7 positions that we were able to hire during the pandemic to help us with the millions of dollars of emergency funding that we received. Then we also got some other seed funding for some regional coordinators, and we were lucky enough to get state general funds to sustain them going forward. That third one is near and dear to my heart because that's me. So luckily that I get the opportunity to continue to get funded as long as I have a job. And I'm really happy for the legislature to give us that funding. And then I want to mention here for the rate increases for COPE and PAS. It is state general funds, but it mirrored the rate increases from the Medicaid agency. So we got funding for there. And then the last two here for E231 is a new program officer for the guardianship program. And we've seen an increase in cases regarding petitions for guardianship, that specifically from adult protective services, from developmental services, and even some of our waiver clients. So we were lucky enough to get a new position to assist with that. And then the last one on here I want to mention, or two, the last one, but the crisis support services. So our adult protective services received some funding to help clients with rent, food, bed bug remediation, etc. And then the last one I'll mention is the reclassification of the adult protective services social worker 2 positions and the social worker 3s, and even the supervisors, to really mirror some of the other individuals who are doing this for state agencies and address the increased complexity that they've dealt with. So with that, I'll pause and see if you have any questions about enhancement units.
Don?
Thank you. This is Dawn Lyons. Jeff, I was just wondering, with those enhancements, those were from the emergency funding you're talking about. I know there was some talk about eliminating the wait list for the state IL program or independent living program. Is that included in that just wasn't given, or can you explain a little bit about that, or does it belong somewhere else?
So it's Jeff Duncan for the record. So that specific funding you're talking about to address the wait list for the independent living program was not in our budget. That was through the governor's fiscal recovery funds. So that is in process now, but it wasn't a part of our actual budget request.
Thank you. That clears it up for me. I was really confused about that. So.
Yep, no problem. This is Jeff Duncan. That's why I just stuck to our budget, because there's a lot of other streams, but this is what you asked me for, and so I stuck to the script.
And hearing and seeing no further questions, 3271.
Okay, thank you. This is Jeff Duncan again. So the last part I'll cover today is the transfer of the Medicaid programs I mentioned earlier. I'll just do it for short, focus, and then MFP. So all the stuff down there is about transferring the funding and the individuals but we're really excited about the opportunity to embed these two programs into the ADSD operations. They just started on Monday, transitioning over. Unfortunately, similar to other programs, they're facing major vacancies right now in both the grant-funded Money Falls a Person and in the Focus program. But we're excited to at least work with the individuals who are here now and see if we can't build these programs. And if you didn't know, Focus is really intended to provide alternative to institutional settings for Medicaid beneficiaries. Then the other part for the Money Falls a Person, that really helps shifting costs from, say, a nursing home. It helps people transition out of a nursing home back into the community, similar to what Focus has a charge to help with the transition services. So Money Falls a Person, in theory, is kind of helps with some of the funding, and payer. Focus does kind of the outreach and transition work. So that's currently housed with our intake and operations for the for my house. Any questions about the transfer of Focus and MFP?
This is Stephen for the record. So in the interest of full disclosure, I used to work for Focus when it was at Medicaid.
Oh, wow.
So my question is on 903 and 503. Are those the statewide numbers for positions?
Okay, yeah, this is Jeff Doug for the record. So I can tell you that for the Money Falls a Person program specifically, those 3 positions were actually in Las Vegas. Unfortunately, only one of the 3 are actually filled. So we have 2 vacancies in that grant-funded program. Then for the Focus program, there's a total of 10 team members statewide, consisting of and don't quote me on this, I might get this wrong, but a supervisor, and then a nurse, an administrative assistant, and then 7 healthcare coordinators. 6 of those were in the South, and we actually worked with Medicaid to transfer 1 position up to the north. So there's a total of 10 team members for Focus: supervisor, nurse, administrative assistant, and then 7 healthcare coordinators.
Thank you. And that looks like it concludes the budget. Is that correct?
That's all I have for today. Yes.
Got it.
But you had any other questions?
So Miles has provided the answer to my question, which is the PIO for ADSD has provided the rate increase
Thank you.
for DS. So we will make sure. Dawn, do you have a way to save the chat afterwards so that we can make sure that that gets posted?
Yes, I would save the chat.
Thank you. With that, any final questions for Jeff? And I do want to just give you an opportunity to discuss SB 43 as well, since you're here.
Oh, so Jeff Dunn for the record. Let me make sure I remember what SB 43. If Miles is on there, that's our agency bill. Was that 45?
Yeah, that's correct. SB 43 is our agency bill. So what that does is really change our Commission on Aging membership to allow some flexibility within the county seats. So it's a little restrictive the way it's currently written. So just clean up language, and then also language to the state plan as well. So we just added some additional language that made it more streamlined for reporting.
Any questions on either of the bills? Hearing and seeing none. Thank you, Jeff. Thank you, Miles.
Thanks for having us.
With that, we will move to our last presentation from Public and Behavioral Health. Julie, the floor is yours.
Thank you. I'm Julie. I'm the agency manager over at NAMS. I'm sharing. Can you guys all see the PowerPoint presentation our fiscal team made for us?
Yes, we can.
All right. So I'll kind of fly through this because I know you wanted like about 10 minutes. So stop me if I'm going too quick over anything, and I'll welcome any questions. So, oh, it's not letting me. It's not letting me advance. 1 second. Okay, there we go. So this is the org chart for DPBH, and there's a bunch of different divisions under DPBH, so we'll cover all those budget codes. And I did send this PowerPoint to you, so if anybody wants to read this in more detail, they'll have a chance. These are brief description of our different agencies and their sections, just as an overview for anybody. And then there's an overview of the split for last biennium and this biennium of general fund, federal, and other funding. And then that split across each agency. So we'll start with the budget code 3161, which is Southern Nevada Adult Mental Health Services, or SNAMS. And then one of the overview things they called out was the raise, but the raise is for all state employees, and we're really hoping, like the other agencies that presented, that it'll help us fill our vacancy rate. I'm not sure what SNAMS's vacancy rate is, but right now NAMS is about 50% vacancy rate. So we're really hoping that those increases in wages will help us fill those. In addition, so the 3161 SNAMS's budget covers both their civil and forensic facilities. So it covers their inpatient at Ralston Neal, their outpatient services, and then also the Stein for those that are getting competency restoration. So all of those are in there. And so one of the things that changed in this biennium is the correctional lieutenant positions got an additional 1 grade compensation increase, and the correctional sergeants got a 2-step 10% compensational increase. Additionally, here are the M and codes and the enhancements. So SNAMS got 1 additional psychiatrist for their medication clinic services based on their caseload. And then they got 12 intermittent temporary forensic specialist positions, transitioned to full-time state positions for the additional 13 forensic beds that are going to be opening down there. And then they got 21 forensic specialists, FTEs for the D-Pod in Ralston Neal to provide 24-hour care for forensic clients, and then 16 new psychiatric nurses for the state. Additionally, they got a forensic psychologist for Stein, both the state one and contract one, and then their correctional sergeants and correctional lieutenants got those step increases that I mentioned. So then when we look at NAMS's budget, NAMS is covers both the inpatient and outpatient mental health treatment up here in Washoe County. So we have the Deanie Townsend Hospital, and then outpatient services for those who do not need to be inpatient. So we saw a decrease in caseload over the last biennium, and a lot of that was driven by our vacancies, because we couldn't have people on our caseload when we didn't have workers to serve them. So as a result, we did lose 3 psychiatric caseworker positions in this session. We're hoping that if we can see, or if we see a need and our caseloads go up, that we'll regain those positions again later if needed. And then budget 3165 is the crisis response, and that's part of the Suicide Lifeline program, or the 988 program that you guys might have heard of. So this is work to create that continuum of care that they want in Washoe, or in statewide, where it's someone to call, which is 988 if someone's having a mental health crisis, someone to respond, which is that expansion of the mobile crisis teams, and then somewhere to go, which is those crisis stabilization centers. So as part of that, they got some enhancements. They got 10 FTEs. You can see the position breakdown there, to operate, cost, and support emergency crisis response activities. They got data analysts to support showing how those positions and that program is going. And then they got a clinical program planner too, to help with the activities of the telecommunication fees. And all of these positions are funded by the telephone fees that are increasing, so it's not coming out of general funds. And this is a nationwide movement, and this is just how it's getting implemented in Nevada. And then 3168, which is behavioral health admission and administration. I can't talk this afternoon. I apologize. They got one administrative service officer for FTE to provide fiscal oversight and management of the behavioral health budget accounts. Again, that wasn't funded through state funds. And then budget 3170 or prevention and treatment, they did not have any changes, enhancements, or changes in their budget. But here's their mission if people are curious. And then Lakes Crossing 3645, they do the forensic up here in the north, and they're the most secure forensic facility we have in the state. And they got the same increases for their positions, their correction officers that we saw in the south. And then we have the rural clinics 3648, which is the behavioral health services for everywhere but Washoe and Clark. And they got some additional clinic space in Fernley, Urington, and Panaca. Always mess up the pronunciation of that sound, so I apologize if you're from there. And then they got additional funds for rental assistance for those individuals in their mental health court program. And then additionally, we got language added that we could transfer funds across the different agencies, clinical agencies as needed, which is really useful for us. So I went through that all really quick. I welcome any questions you guys might have.
This is Stephen for the record. I just have one quick one. If we can go back to the budgetary pie chart toward the very beginning of the presentation.
Oh.
That one.
Yeah.
So it looks like there was a significant increase in the other funding. Do you know what buckets of money comprise that other category?
It's mostly our billing. It's mostly our medical or Medicaid and Medicare billing. And I think the reason it was so low the last biennium was there was a problem with our clearinghouse, so we weren't collecting. So I think that's been resolved, and that's why you see that up too.
Got it. Thank you.
No problem.
Any other questions for public and behavioral health? Dawn, go ahead.
Thank you. This is Dawn Lyons. I was just curious with the new forensic specialist positions in, it wasn't in both the north and the south, right? It was just in southern Nevada.
Yes.
For Stein Hospital. I was just curious if those positions are filled and you need more that aren't filled, or if you already have a vacancy rate that's pretty high. Because I remember I'd worked there before myself. So I remember that it was hard to keep forensic specialists.
Yeah, I don't know what their vacancy rate is. I can get that if you're curious, but I would be shocked if they didn't have vacancies. But they are trying to open a new facility eventually. So I think they're trying to fill it. And hopefully with the raises, that'll help.
Okay, thank you.
No problem.
Any other questions for public and behavioral health?
Thank you so much.
Appreciate it. So that concludes our budget presentation. So now we will go on to the 11 or 12 bills that we didn't get to last time. We will start with the education bill, which is agenda item number, I believe it's 10.
I think it's 11.
That one died, but it was Senate Bill 158. And it proposed to add cameras in special ed classrooms. Like I said, unfortunately, it did die, but we will hope to bring it back when we get to our actionable items toward the end. We'll hope to bring that back next session. It's about the third or fourth time. So that one died. Are there any questions on that one? It's pretty reasonably straightforward.
This is Dawn Lyons. No questions, but I wanted to clarify that was agenda item number 11.
Thank you. So the next one, I believe, is agenda item number 13, which are the autism bills. All four of those passed, which is Assembly Bill 137, which is for fetal alcohol syndrome diagnosis. Assembly Bill 422, which is a pilot program for fetal alcohol syndrome, which will be run similar to the Autism Treatment Assistance Program. If there are questions, we can certainly funnel those to the program manager. Senate Bill 191 changed the raised the age cap for autism, applied behavioral analysis to the end of person's 26th year, so their 27th birthday essentially. And then it also raised the fee to become either an RBT or be board certified behavioral analyst or BCBA. I believe it was, or maybe BCBA and BC assistant behavior analyst. I'm not 100% sure, but I can certainly get that. Bring that back. Apparently there was a clerical error when they first wrote it. So it was a significant increase from, I think, $25 to $500 if my memory is correct. And then last but not least, Senate Bill 411 made the autism court statewide, and then also made minor changes to the Autism Commission membership, making the school district employees ex officio or non-voting. So those are the four autism bills.
Excuse me, Stephen, this is Dawn Lyons. I just wanted to help everyone find where you're at because it looks like you might have skipped over agenda item number 12 and went on to 13. I know you said you were on 13, but I wanted to clarify that for people in case they were looking for it like me.
Got it, no problem. So then we are going to go to 14, which is the one bill we didn't get to last time, was the People with Disabilities Bill of Rights. That one split it up between adults and transition. And it enumerated several rights that folks with disabilities will now have. Among them, the ability to have state employees as supporters in a supported decision-making agreement. And then to have folks available at meetings, such as adults that are staying in high school until 22, being able to have the parents at IEPs, I would think is how that would be implemented potentially. So that's that one. Let's see what else.
Excuse me, this is Dawn Lyons again. Stephen, I don't know if you want to break every once in a while and allow other people if they had to provide comments or maybe questions and open it up for a little discussion before we keep moving through them. I know we have a really large agenda, but if we could at least pause once in a while to say, anybody want to say anything about these so far? That would
Sure,
be
I was going to do it at the end, but sure, we can do it. Cindy, go ahead.
I think Dawn was reading my mind. This is Cindy Swanson for the record. On the legislation creating civil rights, you mentioned something that is so significant that if an individual wants somebody to be at an IEP meeting with them, I'm assuming, well, I better not assume, what exactly does that mean? So after you're 18, your parents don't get invited. I explain that, Stephen, if you can.
Stephen, for the record, so essentially you are correct that typically, unless there's a guardianship in place, parents do not get invited after 18. So then that would provide them with a way to still invite the parents from 18 to 22.
And how is that operationalized for families?
Let me pull it up real quick. That one was a pretty large one. Let me take a quick look. So this is Senate Bill 315 that we're looking at now under agenda item 14. As soon as it loads, let's take a look.
Thank you.
No problem. So I was correct. Actually, I was correct, partially correct. It's that the student has the right to be involved in the IEP, not their parents. So that may be something we need to correct next session, at least the way I read it.
Mhm.
This is Dawn for the record, Dawn Lyons. What about a supported, what is that called?
Supported decision making.
Yes,
Yeah.
supported decision making should allow for that, right?
Well, unless the school is aware of that, and I think this is a conversation I had with Catherine, and I want to share this with y'all because I think if you would indulge me, I think this is the perfect place. If there is something, let's say, institutionalized within the school system and families know that, then supported decision-making could be it. But unless there's an agreement with the school does not have to let parents know about whether the parents have supported decision-making. But if there's a specific, let's say, delegation of rights or whatever, that parents sign off and say, the student and I agree that I will be part of these meetings, it's really not operationalized with supported decision making. So a parent may not even get a letter that a meeting is happening. And I've witnessed this before. A parent may not get a letter with that acknowledgement unless parents let them know. So in my belief, legislatively, that has to be something that is called out specifically. But it is up to the student to say, yes, I want my parents here. But it has to be something that the school is aware of, and the school is letting families know that this is a possibility. So maybe that's something we do next. We got 2 more years to work on it.
This is Dawn Lyons for the record. I think that's a good thing to bring, possibly have the Silk full council bring to either, I was going to say the Department of Education at first, but then I thought better and I thought we should actually bring this to the advocates, the legal advocates, because I know they're the one in Aging and Disability Services. They're the ones who really pushed for that supported decision-making bill, and maybe they could improve it or help push that forward through the school. So the school system has something in policy.
In Illinois, it was a policy. It became a specific policy because parents didn't know they could do it. And what happened in Illinois, schools had to let students and families know the day the kid turned 18, here is something you need to be aware of. So I'll be happy to do that. I think that's really important. Thank you.
This is Stephen for the record. I'm waiting on a response from my assemblywoman, but that's one that supported decision making is one of the things that I'm going to be seeking to correct next session. So once that happens, I'll make that available to folks for discussion. All right, moving on to back here. Does anybody have any questions on the previous bills that we had discussed? Which were the autism bills or Senate Bill 158. Hearing and seeing none. The next one I believe we're up to is Assembly Bill 528, which is the homelessness San Antonio model. And if Dr.
Stephen,
Cosgrove
this is Dawn Lyons. Can you tell me which agenda number you're on?
Let's see.
We have a several page agenda, so it's hard to keep
Understood.
track.
Believe it's the one, the community integration and social services toward the bottom.
Which is
The bottom of page 4 is where it starts.
Oh, number 16.
Yep, sounds about right.
So
The numbers don't show on my end for some reason.
Can you clarify if the agenda item number 15 has already been discussed when behavioral health presented? so we can know why we're skipping over that? Have we already addressed number 15 about behavioral and mental health bills?
With one exception, yes, we have. We'll come back to it in 1 second. I totally forgot about it.
Okay,
So we're on 16, and then I'm going to turn it over to Dr. Cosgrove real quick for an elevator speech on Assembly Bill 528.
Sure, thanks, Stephen. So Sandra Cosgrove for the record. Assembly Bill 528 was the Speaker's, Assemblyman Yeager's emergency bill that he put in the Saturday before the session ended. And it was presented by Jeremy Aguero. And it was about a 3-hour hearing, so it was quite long. But then after it had the initial hearing, we really didn't hear much about it until it got signed. So when we looked at it and it said there could be up to $200 million going towards homelessness, obviously many of us wanted to know exactly what the bill said, opportunities for community input, I mean, those types of things. After reading the bill, many of us, probably me mostly, was very worried about the fact that the money is going to be given to a private nonprofit. So instead of it going to the counties or the municipalities or some other government agency, what it says is that a private entity that forms a 501c3, so like a normal kind of education nonprofit, that has $75 million that they can contribute of private dollars, they can then leverage that with a match from the state of $75 million. They can go up to $100 million to receive the match. From there, it then kind of lists out that this private entity will address workforce development issues, some mental and behavioral health issues, housing issues related to homelessness, but it's very vague. It says that one of the goals is to make sure that people are not going to be on social services for their whole lives, that they are going to be productive community members. But when we went through and tried to figure out, well, what exactly are they going to be doing for people with disabilities, with people who have mental illness? It's not clear at all. And as far as reporting, once the money is transferred over to this private nonprofit, it just says that the nonprofit will give a report to the executive director of the Governor's Office of Economic Development, so GOED, on a quarterly basis. It doesn't say whether those reports are going to be public. It doesn't say whether they're going to be posted anywhere. And so it's very concerning to me that we have almost $100 million, or we would have $100 million of public funds going to a private nonprofit, and this nonprofit won't go to interim finance, won't go to legislative commission, will not give anything to the Legislative Council Bureau. And it doesn't even say they have to report back to the legislature. And so I think we need to be talking maybe to our county commissioners. If you live in a municipality, talk to your city councilors to see if they can maybe speak to whoever's going to be in charge of dispersing this money to find out if there will be opportunities for community members to have input and to at least get those reports that are going to be given to know what they're doing with the funds.
Are there any questions on 528?
Now, we're assuming that it's going to be the gaming industry here in Clark County, because I do know that the Elaine Wynn Foundation has been working on homeless issues. They just had a big panel discussion over at UNLV about 3 weeks ago. But if that's the only group in the state that has up to $75 million to put down on the line to say they want to do a match, that could also mean that only Clark County is going to get that money, that Washoe won't get it, and none of the rural counties will get the money because they don't have a private entity that has that much money to be able to leverage the public match.
So there'll definitely be something to monitor during the interim.
Yeah, very disturbing. But thanks for letting me provide that summary, Stephen.
No problem. And then would it be possible to Dropbox the video on it as well?
Yep, I'll do that right now.
Thank you. Any questions on 528? So we're going to go back to.
This is Dawn Lyons.
Right.
There's a question in the chat. Which bill were you referencing?
Assembly Bill 528. Going back to agenda item 15 real quick. Assembly Bill 414 was a healthcare power of attorney bill. That was really clean up language to make it the healthcare power of attorney document, more plain language for folks to understand it.
Can I just, this is Dawn Lyons, one more time. I'm sorry to interrupt. Can you, as you're going to each individual agenda item, can you just please, so that people can follow along and know where you're at, say, you know, we're going to go straight to the fourth bullet down, or something to that effect, so that we know where you're at and we don't have to catch up with what you're saying?
Fair enough. So let me take a look. So we will have one of the exhibits that was released this morning was a status report on all bills that are on this list, or at least most of them. And then other bills as well. That was from the DD Council. So if folks have specific questions of what happened to a bill or something like that, we'll make those available after the meeting. So we are going to move to, let's see, 4, 5, give me 1 second, 6. We're going to move to the foster care agenda item, which is, Dawn, if you could help me out with the number on that. It's toward the end of page 5.
Okay, that is all the way at agenda item number 19, discussion regarding foster care / guardianship bills.
Got it. And then we're going to be doing all 3 of them under that agenda item. So Assembly Bill 255 was an adoption bill, which I believe one of them died. So 2 of the 3 died. So the only one that was successful was 255. And
do you mind just specifying whether it's A, B, or SB? Because I know last time we had some confusion in that regard. So if you wouldn't mind.
Assembly Bill 255.
Thank you.
No problem. So that one, Assembly Bill 255, provided that if families adopt a child with disabilities, they can get funding. And the change that was made allowed that funding to come end at the person's 19th birthday, so the end of their 18th year. I did have a question during that process of whether or not how we're going to capture folks that stay in school until they're 22. So that'll be something to work on during the interim. So that takes it. Are there any questions on the foster care bills or guardianship bills? Because the other 2 died. So we'll monitor those for next session. Give me 1/2 second. I think we have one other bill here. There were 2 other bills, but I can't remember which ones they are at the moment. If I think of them beforehand, we'll come back to them. But that's going to take us to our discussion of what we want to focus on during the interim, which is agenda item number 20. So we've got several topics.
This is Dawn Lyons for the record. Stephen, I just want to ask here, before we move on to, looks like one of the last or the last agenda item. There are some agenda items that you completely skipped over and didn't address. Maybe we don't need to talk about those bills. Maybe you could at least ask people if they have questions, but there's agenda item number 12, which was the discussion regarding the Division of Healthcare Financing and Policy, or Medicaid bills. And there's a long list of those that we didn't even address. And I wasn't sure if you just wanted to say, you know, are there any questions about those, or if you had any those specific bills out of those that you wanted to discuss. And
so
then
the reason that we're skipping, this is Stephen for the record, the reason we're skipping is because we had the discussion at the last meeting.
So we're just tabling this agenda. Why did we have it on this one?
Because we had the agencies here. So in case we wanted to discuss them as part of the budget presentation.
Okay, so do you want to allow anyone to ask any questions about those specific agenda items that have been skipped, or do you want to just basically table them because they were covered in the other presentations?
Yes, does anybody have any questions on the bills that we discussed last time?
Okay, we also have agenda item number 17, which is the discussion regarding election bills. And then agenda item number 18, which is regarding executive branch reorganization efforts.
Mhm.
Did you want to address either of those agenda items?
I believe we covered all 4 of those bills between the 2 last time. Let me take a quick look at what the other 2 bills were that we didn't get to.
Maybe you can just recap then and just let us know, like, were there issues that we discussed last time that need to be revisited, or did they pass? That kind of thing, or did you not want to address them?
Sure. So the executive branch reorganization bill, the one comment I'll make is it pretty much got stripped down to almost nothing. And the reason for that, and it passed ultimately, because apparently the chair of the Senate Government Affairs Committee, Senator Flores, said that the governor already had the power to do most of the things he was trying to do. The one thing that was stripped initially before the big strip at the end was there was a proposal to have cabinet secretaries. So for example, folk rehab would have been reporting to, I believe, the Secretary of Education and Workforce if it had passed. But like I said, those secretary positions were stripped before the big strip at the end to almost nothing. I believe, Dr. Cosgrove, do you remember what actually stayed in that bill?
There
431.
was, yeah, this is Sandra Cosgrove. There was some reorganization of Dieter that stayed in there, and some other stuff related to unemployment, and then how they're going to, the criteria for how they hire people and promote people within the system in the state. I think those are the things that were left.
116 pages to about 5 pages.
Yeah. Yep.
Any questions on 430, Senate Bill 431, or any of the bills that we discussed last time? Dawn, go ahead.
Yeah, this is Dawn Lyons. I just wanted to say thank you for going through that and for the extra clarification, Dr. Cosgrove, because we had gotten into a pretty deep discussion about that in previous meetings because of the implications for moving employment first forward, and a few other initiatives that Silk is working on, and a few other organizations, including Vote Nevada and the DD Council, and several different places and people are working on making improvements. So it was something we were watching closely and seeing how that would affect things. And I know it even affected the Commission on Services for People Who Are Deaf, which that portion was taken out of the bill as well. So it's good to know that we can at least have the discussion about what it was, remind everybody what we had talked about and where it went from there, and where it's at now. So I appreciate that.
Are there any questions on the bills that we discussed last time? Let me take a look at the original. This is a lesson not to save things over when I revise them. Let's see.
So did you want to ask if anyone else had any questions or comments about SB 431 from agenda item number 18? Before we
Yes.
move
Does
on?
anybody have any questions on Senate Bill 431?
No input from bulk rehab folks? Okay, thanks, Stephen.
Yeah, if you guys have any questions, I'm happy to answer, but I don't have any questions.
This is Stephen for the record. So you're staying put, is that correct, Rosin?
I'm sorry.
This is Stephen for the record. You're staying put organizationally where you were.
Yes, so essentially that's that bill, sorry, this is Johnson Ellis for the record. Yes, now there was some talk about potentially the reorganization. However, from what I understand, on that last day or last week of the session, all of that language from the bill was crossed off, and the only changes I think that left in the bill are the ones that have to deal with DHRM changes. So there's no other changes from both, and that will be rehab regarding the name change of the department or the structure within the division within the department.
Thank you. Let's see. And this is Stephen for the record. I just looked at the original agenda. So we did end up covering all of the bills that we didn't get to last time. With that, I will give one final opportunity for folks to ask questions on the bills we've discussed both in the last meeting and this one. Hearing and seeing none, that will take us to agenda item number 20, which is our discussion of items to carry forward. So we've got, whoops, at the agenda. First one is employment first. We've had a pretty robust discussion on that. Does anybody have any follow-up questions on employment first? For folks that are on the committee, if you haven't seen yet, we have another committee meeting coming up in about 2 weeks. That was just released this morning. So that's that one.
Stephen, this is Dawn Lyons. I had my hand raised, but I don't know if you could see it.
Sure, go ahead.
I just wanted to add to that, when I scheduled the Employment First Committee meeting, if anyone's interested in that, they can reach out to me, and we're happy to invite anyone to the table who is interested in that. So just reach out to me. My email is in the chat. Thank you.
Yeah. And on that point, since we still have Draws in here, does Voc Rehab want to seat at the table on that?
Michelle is coming.
Oh, okay.
She RSVP'd.
Oh, okay. So our next topic is, I believe, the 700-hour program, if my memory is correct.
Yes.
So that one is my personal pet project, which I will not be leaving the state until it gets fixed. So that, in brief, is a special hiring authority similar to Schedule A for the federal government that allows people with disabilities to receive priority consideration for state employment for a period up to 700 hours, which works out mathematically to 17.5 weeks. So that's one of the issues with it, is that theoretically somebody could end their employment on a Wednesday, and if they have not converted to a permanent probationary employee by that point, their employment would end. But then there's also the issue, larger issue of mental health. Discrimination isn't the right word, but just stigma, I think, is probably the better word, surrounding mental health and disabilities. So that's why. Drazen, do we have an updated number? I know it was about 50% last time. Do we have an updated success number real quick?
No, my apologies that I wasn't prepared to answer that question, so I don't have the updated numbers. What I can say is that the success rate or the employment rate of our 700-hour program is higher than our general employment rate of our general cases. So still a program that is much more successful than our just kind of general VR. So
If you could get us the success number, we would greatly appreciate it.
yes.
Thank you. Thank you. So that takes us to
Can I
touched
just-
on.
I'm sorry that I just wanted to say that this is Don Lyons, by the way. I just wanted to say that's really encouraging to hear that the 700-hour program is more successful than regular voc rehab programs. I am interested in the numbers too, but that's very encouraging, although I'd like to hear more about that. You know, like what is it that makes 700-hour programs so much more effective than the regular voc rehab employment program? So, but that's not for now, maybe for later.
Sounds good. Sounds good. Yeah, happy to come back and talk about that.
Got it. So that takes us to bullying and integration exclusion in K-12 schools, including but not limited to, which we touched on a little bit earlier, cameras in special ed classrooms. So there was a news story in particular on this agenda item several weeks ago, where students with disabilities in the PACE program, and don't ask me what PACE stands for, I'll have to get back to Wendy on that, from a particular school in the South, were excluded from that school's yearbook. And it was basically the remedy that was offered was a refund of the fee to purchase the yearbook. So I'm working with the Department of Ed currently to rewrite the training, and that takes us into our next topic as well. The training for school personnel to make it more broad and more inclusive as well, of all school personnel, not just teachers, because this was the principal who made that remedy request. So I wish Catherine was here. She was earlier, but that'll be her pet project for the interim. We touched on supported decision-making a little bit earlier, so I'll be working on that. Next one is mobility device right to repair. So this one.
May I interrupt one last time, Stephen?
Sure.
This is Don Lyons. I was thinking in light of the time, because we have 10 minutes left and we still need to have public comment. I was thinking maybe it would be easier, because this is a long list, if we could have people just reach out either to you or to me and let us know which of these items you'd like to possibly be a part of a work group on, to work on what we need to do to bring it forward to the next session, or to bring education forward so that we can make things happen that need to happen. If these topics interest you, does that sound good, Stephen? If
Yeah,
they interest you,
that works.
to please just reach out to either Stephen or myself and let us know which topics you're interested in, and we can try and organize something that way.
Got it. And then, what was I going to say? Are there any other topics that we've forgotten before we move into that reaching out afterwards? And that includes members of the public as well. Did we forget anything in the disability space? I know it covers pretty much everything except natural resources in terms of the legislative space. So it's really this broad topic. But if folks think of things afterwards, again, feel free to reach out to Dawn and or myself, and we can organize from there.
This is Dawn. Stephen, would you put your email in the chat for everyone? Mine
Sure.
is already there, but Yeah, I don't think yours is.
So my email is now in the chat. And it's my first name dot last name at alumni as in you graduate from something.unlv.edu. So that takes us to agenda item 21. Our next meeting is going to be December 14th at 1 o'clock. That's a Thursday. Does anybody have any agenda items? Really, the only agenda item that we're going to be focusing on during the interim is agenda item 20 from this agenda of kind of mobilizing work groups surrounding topics. So that will become agenda item number 4 on the next agenda, basically is what's going to happen. This session is kind of concluded. There's already been a couple of special sessions. There may be another one in August. That's what we're hearing. We don't know what it's about yet, but if we need to convene, if it does affect the disability space, we certainly can earlier than December. But does anybody have any other topics they'd like to see on the next agenda? If not, can I accept a motion to accept the limited agenda of roll call, verification of posting and introduction?
This is Dawn Lyons for the record. I don't think you need to have a vote on the next meeting agendas, because we can always, if someone does come up with an idea, they can always just let us know later if they think of something that they couldn't right now. And then we can add that to it, you know. It's just like, we're just going, I think what you're saying is the next agenda items will be about whatever's organized with work groups moving for the next session in the interim. And so that basically covers item number 20 and anything else that someone might come up with that it's a good idea for the disability community. Yeah, that's all I had to say.
So that will take us to agenda item number 22, which is the second public comment session, and I'll start us off. Go ahead, Dawn, go ahead.
Okay, this is Dawn Lyons. I just wanted to let everyone know also, Assemblywoman Tracy Brown May is going to have a solicitation of stakeholder input or a disability forum, so to speak, on Monday, July 17th at 1 p.m. And anyone's invited, I think. So if you don't have that information and you're interested in showing up and telling her about issues that you'd like to see moving forward in legislature for the disability community, reach out to Stephen or myself and we can give you the link, or we can forward the invitation so you are able to participate. And the other thing, I'll let you go, either you or Dr. Cosgrove introduce the Vote Nevada Summer of Civics information.
Right. This is Stephen for the record. So before we introduce that, and there's also another Vote Nevada initiative that I'll introduce in 1 second, or let Dr. Cosgrove do it. But the time for that 7/17 form has changed. Medicaid scheduled a needs assessment meeting, so it's actually going to be at 10 a.m. instead on the 17th, and then the August and October ones have been canceled. So the next one after that will be in December. That just came out this morning. So that official announcement will go out in the morning. So once again, the form is at 10 o'clock on the 17th, not 1 o'clock. So that folks can attend the needs assessment meeting if they so choose. And that's specifically for the age, blind, and disabled population. And then I'll turn it over to Dr. Cosgrove to introduce the 2 initiatives that we're working on through Vote Nevada.
So this is Sandra Cosgrove for the record. So on the 17th, we're going to do a session through Vote Nevada on the Nothing About Us Without Us, just as a panel discussion to make sure that we get that topic introduced to the general public. And I definitely want to do follow-up workshops on that, especially after people aren't traveling quite as much in the summertime, to kind of talk about what does that mean in practice. So, you know, what happens during the legislative session when stuff pops up and no one's talked to the disability community? I'm also worried about that with Assembly Bill 528, that all these decisions are going to get made without any open meeting law, and then no one's going to have input. So I really want to make sure that that becomes something that people are thinking about. And then Stephen, the second initiatives, are you thinking about, you know, what you and Dora are going to do?
Correct.
Yeah, do you want to go ahead and explain those?
Sure. This is Stephen for the record. So Dora and I, August 2nd, 3rd, and 5th, all at 6 o'clock. We're going to be having workshops on what accessibility means, and we're going to break them up by like-minded topics. So I think the first one is education and recruitment. The second one, if my memory is correct, is surrounding physical structures, and the third one, I can't remember what the third one
I
is.
think the third one was like websites.
Yeah,
things that
it's,
are
I can't
online.
remember which order it is, but the third
Yeah.
one's more website and digital content. So like I said, those will be Wednesday, August 2nd, Thursday, August 3rd, and Saturday, August 5th, all at 6 o'clock. And we'll make sure that those RSVP links go out once we finalize guest speakers.
Yeah, and this is Sandra Cosgrove, and everything that we're doing over the summer is going to be recorded, and it'll be on the Vote Nevada blog for people to watch if you don't have the opportunity to attend in person.
Stephen, for the record, and just for clarity, those will all be on Zoom, including the
Yeah.
Nothing About Us
Yeah, they'll
Without
all
Us.
be Zoomed. Yes, that's correct, Sandra Cosgrove.
Dr. Cosgrove, this is Dawn Lyons. If you wouldn't mind putting that web link into the chat, then I can make sure that gets into the minutes for posterity, so people have that link in the future.
For the blog?
Yes.
Okay, yes, I'll do that right now. Okay.
And while Dr. Cosgrove's doing that, is there any further public comment?
I have one other thing, but I want to give anyone else another chance before I speak, if there is anything. Okay.
Seeing none, Dawn, go ahead.
Thank you. This is Dawn Lyons, and I just wanted to say thank you to all. I know a lot of our presenters had to leave already, but thank you to all of our presenters for their generosity for their time and spent here today, and for their information. And thank you for everyone who stuck around till the very end. I really appreciate it. It's a lot of information. And if you guys have any questions, feel free to reach out individually to either Stephen or myself, and we'll get to the bottom of whatever your question is. If we have to reach out to anyone else too, we will. So thank you.
I'll echo that sentiment. With that one final opportunity, is there any public comment? Hearing and seeing none, we are adjourned right on time at 3 o'clock. Thank you all.